The emergency department smells like disinfectant and old coffee. Fluorescent lights hum overhead, casting everything in flat white. It's 6:47 in the morning, and the night shift is dragging itself toward the door, while day shift trickles in, yawning, clutching travel mugs. Dr. Elena Voss stands at the break room sink, scrubbing someone else's coffee pot. The one they left crusted with yesterday's grounds, ringed with brown stains nobody bothered to clean. Her hands move in slow, methodical circles, the way they always do. Precise, controlled, like she's done this 1,000 times in places where precision mattered more than courtesy. The scars catch the light. Thick bands of glossy tissue that ripple across her knuckles, up both wrists, disappearing under the sleeves of her white coat. Not surgical scars, not kitchen burns, something else, something nobody asks about. She's been here 6 months. Nobody asks. She rinses the pot, sets it in the rack, dries her hands on a paper towel. The break room is empty except for the hum of the vending machine and the distant beep of monitors down the hall. She pours herself a cup of black coffee, no sugar, and stands by the window overlooking the parking lot. The sun is just starting to rise, painting the asphalt orange. She drinks, doesn't sit, just stands. Down the hall, voices drift from the nursing station. Dr. Marcus Chen, second-year resident, leans against the counter flipping through charts. Nurse Jenna Ortiz scrolls through her phone, half listening. Chen glances up. Did you see Voss restocking the crash cart again yesterday? Ortiz doesn't look up. Yeah, why does she do that? No idea. That's not even her job. She's an attending. Maybe she's paranoid, Ortiz says. Or she doesn't trust anyone. Chen frowns. She's got this weird energy, like she's always waiting for something bad to happen. Maybe something bad did happen, Ortiz says quietly. Chen doesn't respond. He just watches as Elena walks past the station, white coat buttoned, stethoscope draped around her neck, clipboard in hand. She doesn't look at them, doesn't acknowledge them, just walks. There's something in the way she moves, shoulders square, spine straight, eyes forward, like she's still marching. She turns the corner and disappears into the patient wing. Chen shakes his head. She's strange. Ortiz finally looks up. Strange doesn't mean wrong. Elena stops outside room 214. Mr. Callahan, post-op day 2, abdominal surgery. She knocks once, pushes the door open. He's sitting upright in bed, grimacing, one hand pressed to his side. Morning, Mr. Callahan, she says. How are you feeling? Worse than yesterday, he mutters. Thought I was supposed to feel better by now. She moves to his bedside, pulls out her stethoscope. Let me listen. He leans forward. She listens to his lungs, front, back, lower left. She pauses, listens again. Take a deep breath for me. He does. There's a faint crackle, barely audible. Most doctors would miss it. She straightens. I'm ordering a chest x-ray. The surgeon said I was fine. You were fine yesterday. You're not fine today. What's wrong? Fluid might be building up in your lung. It happens sometimes after surgery. We'll check. She writes the order, clips it to the chart, and leaves. No hesitation, no second guessing, just certainty. 4 hours later, Chen pulls up the radiology report on his computer. Small pleural effusion, left lower lobe. Exactly where she said it would be. He stares at the screen. She called it, he mutters, before he even had symptoms. Ortiz glances over his shoulder. Lucky guess. That's the 3rd time this month, so she's cautious. No, Chen says slowly. She's something else. He looks across the hall. Elena stands alone at the medication cart, drawing up syringes with the kind of speed and precision that doesn't come from textbooks. It comes from repetition, muscle memory. The kind you build when seconds matter and mistakes kill. She doesn't notice him watching. She just works, fast, efficient, silent. By the time her shift ends, the sun is setting. The department is quieter now, winding down into the lull before the night chaos begins. Elena watts to the locker room, peels off her white coat, hangs it on the hook inside her locker. Underneath, a faded green t-shirt. No jewelry, no watch, just the scars. She opens the locker door wider. Inside, taped to the metal, is a single photograph. Folded, creased, worn at the edges. 5 people in desert camouflage, arms slung over each other's shoulders, squinting into the sun. Dust on their boots, sweat on their faces. Smiling. Elena's younger in the photo. Her hair is longer, her face is thinner, but the eyes are the same. tired, watchful, carrying weight. She doesn't take the photo out. She just looks at it for a moment. Then she closes the locker, grabs her bag and leaves. The parking lot is nearly empty. She walks to her car, a 10-year-old sedan with a dent in the back bumper. She gets in, sets her bag on the passenger seat, and sits there for a moment with the engine off. In the rearview mirror, she can see Chen and Ortiz walking to their cars, laughing about something. Easy, light, the way people laugh when they haven't seen things break. She used to laugh like that. She starts the car. Hanging from the ignition is a small metal carabiner. Scratched, worn, standard military issue. She touches it briefly, then pulls out of the lot and drives home. Inside the hospital, the fluorescent lights hum on, the monitors beep, the next shift clocks in. And nobody notices that the woman who restocks the crash carts, who calls the complications before they happen, who never sits in the break room, has hands that look like they've pulled someone out of fire. Nobody asks. Not yet. The hospital at 3 a.m. has its own kind of silence. Not quiet exactly. The ventilation system hums. Monitors beep in distant rooms. A phone rings somewhere down the hall, muffled and far away. But the chaos of daylight is gone, replaced by something slower, heavier. Elena sits in the doctor's lounge, legs crossed, reading a journal. Not the usual fare, not JAMA or any JM. The cover reads, Journal of Trauma and Acute Care Surgery, an article on hemorrhage control in austere environments. She highlights a passage about tourniquet placement, her pen moving in neat, controlled strokes. Most emergency attendings don't read military trauma. My journal's at 3 a.m. Most emergency attendings are asleep. She turns the page, then stops. A sound, distant, metallic. A gurney wheel locking up, screeching against linoleum. Her head snaps up. Her body goes still, but not frozen. Ready. Weight shifts forward onto the balls of her feet. Her breathing slows, eyes sharp, scanning the doorway. The sound fades. She blinks, looks down at her hands. They're gripping the armrests, knuckles white beneath the scar tissue. She releases, slowly, forces her shoulders down. It's just a gurney, just a wheel. For half a second, it wasn't. For half a second, it was the whine of an incoming shell, the screech of metal tearing, the sound that comes right before everything goes wrong. She closes the journal, stands, shakes it off. The break room is empty when she walks in. She pours coffee into a styrofoam cup, black, no sugar, and stands by the counter. The fluorescent light flickers once, then steadies. The door swings open. Dr. Liam Booker steps in, night attending, mid-50s, perpetually tired. He's been doing this for 20 years, and it shows in the lines around his eyes, the gray in his beard. He pours his own coffee, glances at her. You're here early. Couldn't sleep. Yeah, I know the feeling. He leans against the counter, sipping, quiet for a moment. Then, casual, like he's asking about the weather. Lou prior service? Her hand stops halfway to her mouth. Just for a heartbeat. Then she sits, sets the cup down. Why do you ask? Just a hunch. The way you stand. The way you check exits when you walk into a room. She doesn't answer. Booker watches her, not pushing, just observing. It's okay if you are. A lot of docs come from that world. I'm just an ED attending, she says quietly. He nods, doesn't press. But as he leaves, he glances back at her one more time. The way she stands, weight balanced, left hand resting on her right wrist. Like she's used to wearing a watch she doesn't own anymore. The supply closet smells like plastic and cardboard. Elena restocks IV kits, organizing them by gauge, by flow rate, by size. She does it without thinking, muscle memory. The kind that comes from doing it in the back of a truck, in a tent with no walls, in a helicopter with the doors off and dust everywhere. She stops, looks at her hands. The scars ripple under the fluorescent light, thick, shiny, patterned like melted wax. She closes her eyes. The smell of smoke, the heat of metal glowing red. Hands, her hands, reaching through a shattered window, grabbing fabric, pulling, dragging dead weight through a space too small, skin blistering, someone screaming. She doesn't stop, she doesn't let go. She pulls until he's out, until he's on the ground, until she can breathe again. She opens her eyes. The supply closet is quiet, sterile, safe. She closes the cabinet and walks out. The parking lot is empty when her shift ends. Dawn is just breaking, painting the sky in shades of pale orange and gray. She sits in her car with the engine off, hands on the wheel. In the rearview mirror, she sees Ortiz and Chen walking to their cars, laughing about something. Chen says something. Ortiz shoves him playfully. They both laugh again. She used to laugh like that, before she learned that laughter is a luxury you can't afford when people are dying faster than you can save them. She looks down at the keychain hanging from the ignition. A small metal carabiner, scratched, dented, standard issue. She got it in basic, kept it through deployment, through everything. She starts the car and drives home. Her apartment is small. 1 bedroom, minimal furniture, no pictures on the walls, just a couch, a table, a bed. The kind of place someone lives in when they're not planning to stay long. She sets her bag by the door, pulls off her shoes, and walks to the kitchen. Opens the cabinet. Inside, lined up in neat rows, are cans of soup, boxes of pasta, protein bars. All organized, all labeled, all ready. She doesn't know why she does it anymore. There's a grocery store 2 blocks away, but the habit remains. Always be ready, always have supplies, always prepare for the worst. She closes the cabinet without taking anything out. In the bedroom, she lies down on top of the covers, still in her scrubs. She stares at the ceiling. The fan turns slowly overhead, creaking on every 3rd rotation. She doesn't sleep. She hasn't slept well in years. 3 hours, maybe 4 if she's lucky. The rest is just lying here, waiting for the alarm, listening to the sounds of the building settle around her. Somewhere in the distance, a siren wails. Ambulance, probably. Heading to the hospital. Someone's worst day. She used to be the one running toward that sound. Now she just waits for it to arrive. She closes her eyes, tries to breathe, tries not to think about the things that wait in the dark behind her eyelids. But they're always there. The faces, the voices, the ones she saved, the ones she didn't, the ones who didn't make it home. She opens her eyes, stares at the ceiling. The fan creaks. 3 hours until her next shift. She'll be ready. The emergency department at 2:30 in the afternoon is controlled chaos. Patients in every bay. Nurses moving between rooms. Residents checking labs on computers. The low hum of conversation, punctuated by monitor alarms and the occasional raised voice. Elena stands near the supply cart, refilling glove boxes. It's not her job. She does it anyway. The overhead PA crackles to life. Trauma alert. ETA 4 minutes. Motor vehicle collision. Rollover. 3 critical. The department shifts. Conversations stop. Residents look up. Nurses grab gowns and gloves. Booker steps out of his office, already pulling on a trauma gown. Bays 2, 3, and 4, he calls out. Chen, you're on the first. Ortiz, get intubation ready. Let's move. Elena steps back, watches. Her hands rest at her sides, loose, ready. The ambulance bay doors burst open. The first gurney crashes through. Paramedics on either side. A young man, late 20s, unconscious. Blood streaked across his chest and face. One paramedic is doing compressions, fast and hard, counting under his breath. Unrestrained driver, ejection from vehicle. The paramedic shouts as they wheel him into Bay 3. Hypotensive in the field, GCS 3, lost pulse about a minute out. Chen takes over compressions the second they stop moving. Get me epi, someone bag him, let's. It's go. Ortiz moves to the head of the bed, laryngoscope in hand. She tilts the patient's head back, slides the blade in. Her hands are shaking. Blood pools in the airway. She can't see the cords. I can't. There's too much blood. I can't see. Suction, Chen yells, still doing compressions. A nurse hands her the suction catheter. Ortiz tries again. The tube won't pass. She pulls back, tries again. Nothing. Come on, she mutters. Come on. The monitor flatlines. The alarm screams. Push another round of epi, Chen shouts. Booker steps closer. How long has he been down? 3 minutes in the field, 2 here, the paramedic says. Booker's jaw tightens. He looks at the monitor, looks at Chen. Keep going. Elena stands in the doorway. Her eyes track every movement. The compressions are too shallow. The airway isn't secure. They're losing time. Not yet. The second gurney rolls in. A woman, mid-30s, conscious but struggling to breathe. Her chest moves wrong. One side rising while the other stays flat. Flail chest, probable rib fractures. Her lips are pale, turning blue. Decreased breath sounds on the right, the second paramedic reports. Possible pneumothorax. Booker moves to her side. Needle decompression, now. A resident steps forward, hands shaking as he preps the needle. Are you sure? What if it's not? Do it. The resident inserts the needle into the second intercostal space, mid-clavicular line. He pulls back on the syringe. Nothing. No air. No hiss. The woman's oxygen saturation drops. 92, 87, 83. It's not working, the resident says, voice rising. Try again. He tries. Still nothing. The patient's breathing gets faster, shallower. Her eyes go wide with panic. Booker curses under his breath. Someone get me. Elena steps into the room. Her voice is calm, quiet, and cuts through the noise like a blade. She needs a chest tube, not a needle. Everyone stops. Booker turns. Voss? This isn't. Her trachea's deviated. It's a tension pneumothorax. A needle's not long enough to reach the pleural space. Booker stares at her. 2 seconds. 3. Do it, he says. Elena moves. Gloves on in one smooth motion. She positions herself at the patient's side, palpates the ribs. 5th intercostal space, mid-axillary line. Betadine, she says to Ortiz. Ortiz hesitates, then swabs the area. Elena takes the scalpel. 1 clean incision, 2 centimeters long. She doesn't hesitate. Blunt dissection through the muscle with her finger. She feels the pleural membrane, pushes through. Air hisses out, loud, immediate. She slides the chest tube in, smooth and controlled, advances it into the pleural cavity. Secures it with sutures, fast and precise. The monitor beeps. The patient's oxygen saturation climbs. 86, 90, 94. The woman gasps. Her breathing slows, deepens. Silence fills the room. Everyone stares at Elena. She strips off her gloves, drops them in the bin. Get her to radiology, confirm placement. She walks out. Chen stands frozen, hands still on the first patient's chest. Where the hell did she learn to do that? Booker doesn't answer. He's watching Elena disappear down the hallway. In the corridor, Elena stops. Leans against the wall. Her hands are steady, but her breathing isn't. She closes her eyes, counts to 5, opens them again. She can still smell it. Dust, diesel, blood. The inside of a field hospital with canvas walls and a dirt floor. She pushes off the wall and keeps walking. Later, in the nursing station, Ortiz and Chen huddle over a computer, voices low. That was field medicine, Chen says. That wasn't hospital protocol. She didn't even hesitate, Ortiz whispers. Like she's done it 100 times. You think she was deployed? I think she's done that in the back of a truck with no lights and no backup. Chen glances down the hall. Elena sits alone in the break room, staring at a cup of coffee she hasn't touched. Who is she? He asks quietly. Ortiz doesn't answer. In the locker room at the end of her shift, Elena sits on the bench, elbows on her knees, head down. Her hands rest open in her lap. The scars catch the light. She hears footsteps. Booker appears in the doorway. That was good work today, he says. She doesn't look up. I just did what needed to be done. That wasn't textbook, Voss. That was combat medicine. She finally looks at him. Does it matter? Yeah, he says quietly. It does, because I need to know who I'm working with. You're working with someone who saves lives. That's all you need to know. Booker studies her for a long moment. Then he nods. All right. But if you ever want to talk, I don't. He leaves. Elena closes her locker, walks out into the parking lot. The sun is setting, painting everything in shades of orange and red. She gets in her car, sits there with the engine off. In the rearview mirror, she sees her own eyes, tired, haunted, still fighting. She starts the car and drives home. The hospital cafeteria at 6:45 in the evening is nearly empty. A few nurses picking at salads, a janitor mopping near the drink machines. The fluorescent lights buzz overhead, casting everything in pale yellow. Elena sits alone at a corner table, tray in front of her. A sandwich she hasn't touched, a cup of coffee going cold. She's not eating, just sitting, staring at nothing. The door opens. A man walks in, late 50s, gray at the temples, wearing jeans and a flannel shirt, civilian clothes. But everything about him says otherwise. The way he stands. The way his eyes sweep the room before he moves. The way he walks, controlled and deliberate, like every step has a purpose. He gets coffee from the machine, black, no sugar. He sits 3 tables away, doesn't look at her, just drinks his coffee. 1 minute passes, then another. Elena feels it before she sees it, the weight of his attention, the way the air changes when someone is watching you. She glances up. He's looking at her now, not staring, just looking, like he's trying to remember something. He stands, walks toward her table. Mind if I sit? Elena looks at him, studies his face. She doesn't know him. It's a free country. He sits down across from her, sets his coffee on the table, takes a slow sip. You don't remember me, he says. Should I? Kandahar, 2012. Forward Surgical Team Bravo. Her hand stops halfway to her cup. She sets it down carefully. Yay, slowly. I think you have me confused with someone else. Captain Elena Voss, 228 Combat Support Hospital. You pulled 3 Marines out of a burning MRAP after an IED strike. One of them was my nephew. The cafeteria feels suddenly smaller, the air thinner. Elena's voice is quiet, controlled. I'm not that person anymore. Colonel David Hargrove, still active, National Guard. And yes, you are. Across the cafeteria, 2 nurses have stopped talking. They're listening now, pretending not to, but their heads are turned just slightly in their direction. Elena leans forward. Her voice drops. I'm in emergency attending now. That's all. Hargrove doesn't move. You saved my nephew's life. 3rd-degree burns over 40% of his body. You kept him alive for 6 hours until the medevac came. You used field dressings, IV saline from a camelback, and morphine you rationed from your own med kit. A lot of people did a lot of things over there. Not like you. He leans forward too. He told me about your hands. You burned them, pulling him through the door. The metal frame was glowing red. You didn't stop. You pulled him out, stabilized him, and kept working. You didn't report the injury. You didn't file for a commendation. You just kept going. Elena looks down at her hands. The scars are visible, even in the dim light. She flexes her fingers once, then stills them. It was my job. No, your job was to stay behind the wire. You went outside it. You ran toward the fire when everyone else ran away. Why are you here? Hargrove sits back. His voice softens. Because Tyler's getting married next month, and he asked me to find you, to thank you. Took me 2 years. You didn't make it easy. I didn't want to be found. I know. But your medical license is public record, and there aren't many emergency docs named Elena Voss, who served in Kandahar in 2012. Elena's jaw tightens. She doesn't respond. Hargrove reaches into his pocket, pulls out a small business card, slides it across the table. You're a hell of a doctor, Captain, and you're wasting yourself hiding in this hospital. I'm not hiding. Yes, you are. The words land like a punch, quiet but solid. Elena stares at the card, doesn't pick it up. Hargrove stands. If you ever want to stop running, give me a call. He leaves. The door swings shut behind him. Elena sits alone. The cafeteria is silent except for the hum of the refrigerators and the distant clatter of dishes being washed. She picks up the card, turns it over in her fingers. It's simple. Just a name, a phone number, nothing else. She sets it down on the table, stares at it. Across the room, the 2 nurses are whispering now. One of them glances over. Their eyes meet. The nurse looks away quickly. Elena stands, leaves the tray on the table, walks out. In the hallway, Chen and Ortiz are standing near the vending machines. They stop talking the moment they see her. Chen opens his mouth, closes it, opens it again. Was that guy talking about Afghanistan? Elena doesn't stop walking. It's none of your business. Did he just call you Captain? She keeps walking. Ortiz steps in front of her, not blocking her, just standing there. You were. Over there, weren't you? Elena stops, looks at her. I was a lot of things. Were you a surgeon? I was whatever they needed me to be. She walks around Ortiz and heads toward the locker room. Chen and Ortiz stand there, staring after her. Holy shit, Chen whispers. Ortiz doesn't respond. She just watches Elena disappear around the corner. And for the first time, she understands. The way Elena moves. The way she never hesitates. The way she sees things no one else sees. She's not cautious. She's not paranoid. She's been to war. In the locker room, Elena sits on the bench. Her hands are shaking now. Not much, just a tremor. She presses them flat against her thighs, forces them still. She opens her locker. Inside, taped to the metal, is the photograph. 5 people in desert tan, smiling, dusty, alive. She reaches out, touches one face, a young man with dark hair and freckles, grinning at the camera, like he didn't know what was coming. "I'm sorry, Danny," she whispers. She closes the locker, stands, puts on her jacket. When she walks out into the parking lot, the sky is dark. Stars are just starting to appear. She gets in her car, starts the engine. The business card is still in her pocket. She drives home, doesn't look back. But she knows. Everyone knows now. The secret she spent 6 months burying just got dragged into the light, and there's no putting it back. The emergency department erupts at 3 minutes before midnight. The overhead alarm blares, red lights spinning in the corridors. The PA system crackles with static before the voice cuts through. Code red, mass casualty event, industrial explosion, multiple critical. ETA 7 minutes, all available personnel to trauma bays immediately. Doctors spill out of break rooms. Nurses abandon paperwork. Residents pull on gowns mid-stride. The department transforms in seconds, a machine shifting into overdrive. Booker stands in the center of the chaos, barking orders. "I need O negative staged in every bay. Trauma trays open. Airway kits ready. Move." Elena steps out of the medication room, already gloved. She moves through the chaos like water, calm and fluid, while everything around her spins. Chen rushes past, nearly colliding with a nurse. "How many are coming?" Dispatch said at least 8 critical, Ortiz shouts from across the hall. Maybe more. The ambulance bay doors crash open. The first wave arrives, 4 gurneys at once. Blood, burns, screaming. The first patient is a young man, early 20s, covered in soot and ash. His abdomen is impaled with a piece of rebar, still lodged through his torso. The paramedics didn't pull it. Smart. It's the only thing keeping him from bleeding out. "Hypotensive, tachy, GCS 8. The paramedic shouts as they wheel him into Bay 2. "We didn't touch the rebar. It's tamponating something major." Chen takes one look and his face goes pale. "We need to get him to the OR. Ortiz checks the monitor. Pressure's 70/40. He's shocky. "Then we stabilize here and move him." Elena steps forward. Her voice cuts clean through the noise. "He won't make it to the OR." Chen turns. "Voss, we can't just. His pressure's dropping. He's bleeding into his abdomen. If you move. Him now, he'll code in the elevator. So what do you want me to do?" Elena doesn't answer. She just moves, gloves already on. She's at the bedside in 3 steps. 2 units ONEG wide-bore IVs, and get me a vascular tray, she says to Ortiz. Ortiz stares. "You're not a surgeon." Elena looks at her, just looks. And Ortiz sees something in her eyes that makes her stop talking and start moving. "Get it, now." Booker steps closer. "Voss, if you're going to do this, if I don't, he's dead." She looks up at him. "You know that." Booker hesitates, then nods. "Do it." Elena works. Betadine swabbed across the abdomen, scalpel in hand. 1 clean incision, lateral to the rebar. She's not removing it yet. She needs to see what's underneath first. Her hands move fast, controlled, like they've done this 1,000 times. Because they have. Just not here. Not in a clean room with bright lights and backup. She extends the incision, clamps bleeders as she goes. Suction clears the field. Blood wells up, dark and thick. "Suction," she says quietly. A nurse responds instantly. The field clears. Elena sees it. Hepatic artery, torn. The rebar is pressed against it, holding it closed. "There," she says. "I need a clamp and suture. 4-0 vicryl." Chen hands her the suture with shaking hands. Elena doesn't shake. She ties off the vessel proximal to the tear. Fast, clean, perfect. The bleeding slows, stops. She checks the pressure. It's climbing. 80/50, 90/60. "Stabilize the rebar and get him to CT," she says. "He'll need proper surgery, but he'll make it there now." She steps back, strips off her gloves. The room is silent except for the beeping of the monitor. Chen stares at her. "How did you—" The sound cuts him off. A deep, rhythmic thudding. Low at first, then louder. Helicopter. Not passing overhead. Landing. On the roof. Everyone stops. Looks up. Booker frowns. "We didn't call for airlift." The elevator at the far end of the hall dings. The doors slide open. 3 figures step out. Military uniforms. Digital camouflage. Combat medic patches on their shoulders. They move with purpose, scanning the room, assessing. And behind them, Colonel David Hargrove. He's in uniform now. Not the flannel shirt and jeans. Full dress. Rank insignia visible. Command presence unmistakable. He walks straight toward Elena. The entire department watches. Captain Voss, he says. Elena doesn't move. I'm off duty. Not anymore. His voice is firm but not unkind. National Guard convoy overturned 30 miles north. 12 casualties. Field hospitals compromised by terrain. You're the closest trauma-capable surgeon we have. I'm not a surgeon. You were 10 minutes ago. Silence. Heavy and thick. Elena shakes her head. Send someone else. There is no one else. Those kids are bleeding out in a ditch right now because we don't have anyone with your skill set within 100 miles. I can't. Hargrove steps closer. His voice drops, quiet enough that only she can hear. You didn't stop being a soldier when you took off the uniform. You know that. And right now, 12 people need you. Just like Tyler did. Elena closes her eyes. I left that behind. No, you didn't. You just pretended you did. She opens her eyes, looks at him. I'm done with that life. You saved a man's life 20 minutes ago with a field procedure you learned in a war zone. You're not done. You're just scared. The words hit like a slap. Elena's jaw tightens. She looks past Hargrove at the medics waiting by the elevator. Young, ready, trusting. She looks back at Hargrove. I'll need a full trauma kit. Already on the bird. She walks toward the elevator. Doesn't look back. Booker calls after her. Voss. She stops. Turns halfway. Who are you? He asks. Elena looks at him for a long moment. Someone who couldn't let go. The elevator doors close. The department stands frozen. Chen and Ortiz stare at the closed doors, at the space where Elena was standing. She's going back, Ortiz whispers. Chen doesn't respond. He just stares. On the roof, the helicopter's rotors are already spinning. Elena climbs in, pulls on a headset. Hargrove climbs in beside her. The medics strap in across from them. The helicopter lifts off. The hospital shrinks below them, lights glowing in the darkness. Elena stares out the window. Her hands rest on her knees, steady now, no shaking. Hargrove's voice comes through the headset. You okay? She doesn't answer right away. Then, quietly, I told myself I'd never do this again. Why'd you stop? Because I lost count. Of what? How many I couldn't save. Hargrove is silent for a moment. Then, Tyler told me you never slept. Not once. The whole time you were in that FOB. There were too many of them. You can't save everyone. I know. So why do you keep trying? She finally looks at him. Because if I stop, then what was it all for? Hargrove nods slowly, says nothing. The helicopter cuts through the night sky. Below, darkness. Ahead, the glow of floodlights. Elena closes her eyes, breathes. She's going back. The helicopter descends through darkness, rotors chopping the night air into rhythm and noise. Elena watches through the window as floodlights come into view, scattered across a stretch of highway flanked by trees. Overturned vehicles, figures moving between them. The organized chaos of a disaster that's still unfolding. The skids touch down in a dirt clearing 50 yards from the wreckage. The moment the helicopter settles, Elena unbuckles and jumps out, medic bag already in hand. The smell hits her first. Diesel fuel, scorched rubber, blood. The same smell. Always the same. A young sergeant runs toward them, face streaked with dirt and sweat. Ma'am, we've got 2 critical in triage, 4 stable, 6 more we're still extracting. Elena doesn't break stride. Show me the critical. He leads her to a makeshift triage area, tarps spread on the ground, IVs hanging from side mirrors and tree branches. Medics work under portable lights, their shadows long and jagged. The first patient is a woman, early 20s, pale as paper. Compound fracture of the left femur, bone visible through torn skin. Her pulse is thready, skin cold and clammy. Elena kneels beside her, checks the leg. The skin above the fracture is mottled, dusky. Internal bleeding into the thigh. How long has she been like this? Elena asks. 40 minutes. A medic says, we can't stabilize her pressure. Elena palpates the femur, feels the swelling. She's bleeding into the thigh. I need a tourniquet and morphine. We use the last tourniquet on. Elena doesn't wait. She unbuckles her own belt, wraps it around the woman's thigh just above the fracture, pulls it tight and twists. The bleeding slows. Start a line, push fluids, and get her on the next bird out. The medic nods, moving fast now. Elena stands, moves to the next patient. A man in his mid-30s, lying on his side, breathing fast and shallow. His lips are blue. She listens to his chest. Absent breath sounds on the right. Trachea deviated to the left. Tension pneumothorax, she says. Not a question, a statement. She preps the area, no hesitation. Betadine, scalpel, incision at the 5th intercostal space, blunt dissection with her finger. She feels the pleura, pushes through. Air hisses out, loud and immediate. She slides the chest tube in, advances it, sutures it in place. The man gasps, his color improving within seconds. Bag him and get him stable for transport, she tells the medic. She moves to the next, and the next. A sucking chest wound, sealed with an occlusive dressing. A fractured pelvis, stabilized with a makeshift binder. A head injury with blown pupils. Nothing she can do here, but she intubates him anyway, gives him a chance. 2 hours pass, maybe 3. Time loses meaning. There's only the next patient, the next problem, the next decision. When the last patient is loaded onto the helicopter, Elena stands in the dirt, blood on her gloves, sweat and dust on her face. The floodlights cast her shadow long across the ground. Hargrove approaches, his boots crunching on gravel. 12 went in, 12 are going home. Because of you. Elena strips off her gloves. Her hands are shaking now, the adrenaline draining away. We got lucky. No, they did. She looks at him, tired, worn. I did what anyone would do. No, you did what you were trained to do, what you've always done. She turns away, stares at the wreckage, the overturned trucks, the shattered glass glinting in the floodlights. Hargrove stands beside her, quiet for a moment. Then, you should have gotten a medal for what you did in Kandahar. I don't want a medal. Then, what do you want? She closes her eyes. I want to stop seeing their faces. Whose? The ones I couldn't save. Hargrove is silent. Then, gently, Tyler's 29 now. He's a high school teacher. He's marrying a woman he met in physical therapy. He runs every morning. He's alive because of you. Elena's throat tightens. She doesn't respond. He's not the only one, Hargrove continues. I pulled the records. In 18 months deployed, you treated over 300 casualties. 264 survived. Those are the best numbers in your unit, in any unit. What about the other 36? They were already gone, Elena. You gave them a chance. That's all anyone can do. She shakes her head. It wasn't enough. It never feels like enough. That's what makes you good at this. She opens her eyes, looks at him. I left because I couldn't do it anymore. Every face, every name. I couldn't carry them. So you ran. So I survived. Hargrove steps in front of her, makes her look at him. Surviving isn't the same as living. You know that. I'm trying. No. You're hiding. There's a difference. She wants to argue, wants to tell him he's wrong, but she can't. Because he's right. I don't know how to do this anymore, she says quietly. How to be that person without it destroying me. You do it by remembering that you're not alone. You do it by letting people in. You do it by accepting that you don't have to carry it all by yourself. Elena looks past him, at the medics tacking up gear, at the helicopters lifting off, one by one, carrying the wounded to safety. I spent so long being the one who saves people, she says. I forgot how to be the one who gets saved. Hargrove's voice is soft. Then, let someone try. She doesn't respond, just stands there, the weight of years pressing down on her shoulders. Hargrove reaches into his pocket, pulls out a photograph, hands it to her. It's a wedding invitation. Tyler Hargrove and Emma Chen. She recognizes the young man in the photo, older now, smiling. Scars visible on his neck and arms, but smiling. He wants you there, Hargrove says. He needs to say thank you, in person. Elena stares at the photo. Her hands are still shaking. I don't know if I can. You just saved 12 people in the middle of nowhere with a belt and a scalpel. You can sit through a wedding. She almost smiles. Almost. I'll think about it. That's all I'm asking. The helicopter engines roar to life. Hargrove gestures toward it. Come on, let's get you home. Elena climbs in. The helicopter lifts off, and she watches the wreckage shrink below them. The floodlights fading into pinpricks, then darkness. She looks down at her hands. The scars are still there, always will be. But maybe Hargrove's right. Maybe it's time to stop running. Maybe it's time to let someone see. 1 week later, Elena walks through the emergency department doors at 7 in the morning. The fluorescent lights hum overhead. The smell of antiseptic and coffee fills the air. Everything looks the same as it did before. But it's not. The moment she steps into view, conversations stop. Nurses glance up from their stations. Residents pause mid-stride. Everyone watches her walk down the hallway, white coat buttoned, Stethoscope around her neck, the same as always. Except now they know. Ortiz is the first to approach. She stands near the medication cart, arms crossed, expression unreadable. When Elena passes, she speaks quietly. You came back. Elena stops, turns. I came back. We weren't sure you would. Neither was I. Ortiz nods slowly. Then, softer. What you did out there, we heard about it. 12 saves, 0 losses. They had good medics. They had you. Elena doesn't know what to say to that. So she just nods and keeps walking. Booker is waiting near the trauma bay. He's holding a coffee, steam rising from the cup. He watches her approach with an expression that's hard to read. Respect, maybe, or something close to it. Morning, Voss. Morning. He gestures toward his office. Got a minute? She follows him in. The office is small, cluttered with charts and outdated medical journals. Booker closes the door, leans against his desk. I owe you an apology, he says. Elena frowns. For what? For not seeing it sooner. For letting you restock supply carts and run labs when you should have been doing what you were trained to do. I didn't tell you. You shouldn't have had to. He sets his coffee down. I've been doing this a long time. I should have recognized it. The way you move, the way you see things before they happen. That doesn't come from medical school. That comes from experience. The kind you get when lives depend on it. Elena looks down at her hands. I didn't want anyone to know. Why not? Because I didn't want to be that person anymore. I wanted to be normal. To do normal medicine in a normal hospital where people don't die faster than you can save them. Booker nods. And now? Now I don't know what I want. She looks up at him. I just know I can't keep pretending I'm something I'm not. He reaches behind him, picks up a folder from his desk, hands it to her. Then don't. Elena takes it, opens it. Inside is an offer letter. Trauma surgery attending. Full-time position. Start date in 6 months, pending completion of credentialing and board certification review. She stares at it. I don't have a trauma fellowship. Yes, you do. Military equivalency. You did 2 years with the forward surgical team. That counts. We just need to process the paperwork. I haven't operated in a hospital setting in years. You operated last week. Twice. Once here, once in a field with no lights and no backup. You saved lives both times. He crosses his arms. Look, I'm not going to force you, but we need someone like you, and I think you need this too. Elena looks at the folder, at the words printed on the page. Trauma surgery attending. Dr. Elena Voss. I'll think about it, she says quietly. That's all I'm asking. She leaves the office, folder tucked under her arm. In the hallway, Chen is waiting. He shifts his weight from foot to foot, nervous. When she approaches, he straightens. Dr. Voss, can I talk to you? Sure. He glances around, then lowers his voice. I owe you an apology. I thought you were paranoid, or trying too hard. I didn't realize you were just better than the rest of us. I'm not better. I've just seen worse. That's what I mean. He runs a hand through his hair. I've been thinking about what you did. The chest tube, the vascular repair. I couldn't have done that. I wouldn't have even known where to start. And I realized I've been walking around thinking I knew what I was doing, but I don't. Not really. Not like you. Elena studies him. He's young, mid-20s, maybe. Eager, scared, trying so hard to prove himself. She recognizes that look. She used to see it in the mirror. You'll learn, she says. You just need time. And someone willing to teach you. Will you? She hesitates, then nods. Yeah, I will. Relief floods his face. Thank you. Over the next few days, the department shifts around her. Not dramatically, not all at once, but in small, quiet ways. Residents start asking her questions. Not just clinical questions, but real ones. How do you stay calm when everything's falling apart? How do you make decisions when there's no time to think? How do you live with the ones you lose? She answers as best she can, honestly, without sugarcoating it. Nurses start trusting her judgment without question. When she calls for something, they move. No hesitation, no second guessing. Booker states pulling her into complex cases, not as a consultant, as a leader. And slowly, carefully, Elena starts to let them in. One afternoon, she sits in the break room with Ortiz. They're both off shift, both exhausted. Ortiz sips tea. Elena drinks coffee. Can I ask you something? Ortiz says. Sure. How do you do it? Go back to normal after all that? Elena sets her cup down. You don't. You just learn to carry it differently. Does it get easier? No, but you get stronger. Ortiz nods slowly. Then, for what it's worth, I'm glad you're here. I'm glad you didn't stay hidden. Elena looks at her. Me too. That evening in the locker room, Elena opens her locker. The photograph is still there. The 5 people in desert tan, smiling, alive. She takes it out, unfolds it carefully, runs her thumb over one face, the young man with dark hair and freckles. I'm still here, Danny, she whispers. I'm still fighting. She doesn't fold it this time. She tucks it into the pocket of her white coat, keeps it close. On her way out, she passes the bulletin board near the staff entrance. Someone's pinned a newspaper clipping. Local news. Headline reads, National Guard Convoy Rescue. All 12 survivors stable. Beneath it, someone has written in marker, Thank you, Dr. Voss. She stops, stares at it. Then she keeps walking. Outside, the sun is setting. The parking lot is half empty. She gets in her car, sets the folder on the passenger seat. The offer letter. Trauma surgery attending. She starts the engine. The carabiner keychain swings from the ignition. She looks at the folder one more time. Then she puts the car in gear and drives home. She hasn't signed it yet, but she will, because Hargrove was right. She's not done. She was never done. She was just scared. And maybe it's time to stop being scared. Maybe it's time to be who she's always been. A soldier, a surgeon, a person who saves lives, not in spite of her past, but because of it. She drives through the city, streetlights flickering on as darkness falls. And for the first time in years, she doesn't feel like she's running. She feels like she's coming home. 2 years later, the emergency department looks different. Not the building, not the layout, but the energy. The way people move, the way they work. Elena walks through the automatic doors at 7 in the morning, white coat crisped, trauma badge clipped to her collar. Beside it, a small pin. Combat medical badge. She doesn't hide it anymore. The nursing station is already busy. Ortiz stands at the computer, reviewing overnight admissions. Chen is beside her, now a senior resident. Confident in a way he wasn't before. Morning, Dr. Voss, Ortiz says. Morning, what do we have? Chen pulls up the board. 2 holds from overnight. 1 chest pain ruled out for MI. 1 abdominal pain waiting on CT. Nothing critical. Good. Let's round. They move through the department together. Elena leads, but she doesn't do everything herself anymore. She taught them. They learned. In the conference room, she stands in front of a group of new residents. First day of their emergency medicine rotation. They look nervous, eager, terrified. She remembers that feeling. All right, she says. Let's talk about tension pneumothorax. What's the first sign? A young resident raises her hand. Decreased breath sounds on the affected side. Good. What else? Tracheal deviation. Correct. And if you see that, what do you do? Needle decompression. And if it doesn't work? The resident hesitates. Chest tube? Not a question, a statement. If needle decompression fails, you go to chest tube. You don't wait. You don't second guess. You act. She looks around the room. In trauma, hesitation kills. Confidence saves lives. You'll make mistakes. Everyone does. But you can't let fear stop you from doing what needs to be done. The residents nod, scribbling notes. We're going to run drills this afternoon. Chest tubes, intubations, vascular access. You'll practice until it's muscle memory. Because when someone's dying in front of you, you won't have time to think. You'll only have time to act. She dismisses them. They file out, whispering among themselves. Chen lingers. You're good at this, teaching. I had good teachers once. She picks up her coffee. I'm just passing it on. Later that morning, the trauma alert sounds. A motorcycle accident. Single vehicle. Critical. Elena moves to the trauma bay. The team is already assembled. Gowns on, gloves ready, IVs staged, blood warming. She nods. Let's work. The gurney crashes through the doors. Nail, mid-20s, helmet on, unconscious. Paramedic running beside him calling out vitals. GCS-5, hypotensive, probable internal bleeding. Ortiz moves to the head of the bed. I've got the airway. Chen starts the trauma protocol. 2 large-bore IVs, type and cross for 6 units. Elena watches, guides, but doesn't take over. She doesn't need to. Ortiz intubates on the first attempt. Smooth, controlled. Chen identifies free fluid on the ultrasound. Positive fast. He needs surgery. Call the OR, Elena says, and get him moving. They stabilize him in under 10 minutes. The gurney rolls toward the elevator, the team moving with practiced efficiency. Elena steps back, watches them work together, a machine, a team. Booker appears beside her. Nice job. They did the work. You taught them how. She doesn't argue, just nods. That evening, Elena stands on the hospital rooftop, looking out over the city. The sun is setting, painting the sky in shades of orange and red. The sounds of traffic drift up from below. Footsteps behind her. She turns. Hargrove walks toward her, civilian clothes, hands in his pockets. Thought I'd find you up here. It's quiet. He stands beside her, looking out at the city. Heard you made lead trauma attending. 6 months ago. How's it feel? Strange, good, hard. That's life. She smiles. Just a little. Tyler's wedding was beautiful. You came, that meant a lot to him. I almost didn't. But you did. That's what matters. They stand in silence for a moment, the wind moving around them. You know what the difference? The difference between a good doctor and a great one, Hargrove asks. What? A great one knows that saving lives isn't just about the body. It's about the soul, including your own. Elena nods slowly. I'm working on it. I know you are. Then stops. One more thing. Yeah? Thank you for not giving up. She meets his eyes. Thank you for not letting me. He walks away. She stays, watching the city lights blink on one by one as darkness falls. Later, in the locker room, she opens her locker. The photograph is still there, pinned to the inside door. 5 people in desert tan. But beside it now is another photo. Her team. Ortiz, Chen, Booker, the residents, smiling after a save. Old family, new family. She closes the locker, picks up her bag, walks out. In the parking lot, she gets into her car. The folder Booker gave her 2 years ago sits on the dashboard, signed and sealed. Trauma surgery attending. Official. She starts the engine. The carabiner keychain still hangs from the ignition. She touches it once, briefly, then puts the car in gear. She drives through the city. Streetlights flicker past. The radio plays softly. She doesn't think about the past. Doesn't think about the faces she couldn't save. She thinks about the ones she did. The ones still alive because she didn't give up, because she kept fighting. Tyler, teaching high school students, married now, alive. The woman with the tension pneumothorax, breathing on her own. The man with the rebar through his abdomen, walking out of the hospital 6 weeks later. The 12 soldiers from the convoy, all home safe. 264 faces, 264 lives, and counting. She pulls into her apartment complex, parks, sits for a moment with the engine off. Her hands rest on the wheel. The scars are still there, still visible, but they don't feel like shame anymore. They feel like proof. Proof she survived. Proof she fought. Proof she didn't give up, even when it would have been easier to walk away. She gets out of the car, walks to her apartment, unlocks the door. Inside, the walls aren't bare anymore. There are photos now. People she's saved. Thank you cards from families. A framed newspaper clipping about the convoy rescue. She sets her bag down, makes tea, sits on the couch. Her phone buzzes. A text from Chen. Patient from this morning is stable. Surgery went well. Thanks for teaching us, she types back. You did the work. I'm proud of you. Another buzz. Ortiz. Drinks Friday? The team wants to celebrate your 2-year anniversary. She smiles. Types back. I'll be there. She sets the phone down, sips her tea, looks around her apartment. It's not just a place she lives anymore. It's home. She's not running anymore. She's not hiding. She's exactly where she's supposed to be, doing exactly what she was meant to do, saving lives, teaching others, carrying the weight, but not alone anymore. She closes her eyes, breathes. For the first time in years, she sleeps without nightmares. And when she waits, she'll do it all again, because that's who she is, not in spite of her scars, because of them. A soldier, a surgeon, a teacher, a survivor. Dr. Elena Voss, and she's just getting started.